Hello and welcome to the Midday Brief with me, Kemini Nyamani Amano. In our headlines, Upper East Regional Director of Health Services asks Ministry of Health to scrap allowance given to trainee nurses. In sports, Ghana Black Stars ready for World Cup qualifier against Chipolopolo of Zambia. In foreign news, bomb explodes near the convoy of the Egypt's interior minister in Cairo, wounding at least 7 people. Details of these stories and many more coming up shortly. In our first story, the Upper East Regional Director of Health Services, Dr. John Koku Awuno Williams, has asked the Minister of Health to take the bold decision of scrapping the allowance given trainee nurses, just as has been done by the Ministry of Education. Dr. John Koku Awuno Williams says this will ensure that the only committed nurses are employed into the service. Trainee nurses currently receive allowances to the tune of 356 Ghana cedis a month, and this is believed to have contributed to the lack of motivation for students to pass the exams once and for all. Government recently announced plans to scrap teacher trainee allowance. Joining us on the telephone is the president of the Ghana Registered Nurses Association, Asante Kwabia. Right, Kweku, good afternoon to you.
Good afternoon, my sister.
Kweku, what do you make of this call by the Upper East Regional Director of Health Services?
Well, Dr. Awuno has got the discussion started on this subject matter, according to his opinion, but he got it started on a wrong note because of the views expressed to the effect that it will only enable one of the reasons, of course, that will enable the ministry recruits dedicated nurses and things like that. I cannot agree with him.
But is it true that there seems to be lack of commitment among our nurses because you seem to have a free style of education and so you're not committed on the job?
Yeah, that is also a factor. And but I want Dr. Awuno to also understand that commitment of every professional across the work sector continuum has waned over the years. For example, medical doctors, trainees are not getting allowances, but you cannot tell me that the commitment of his time is the same as commitment of medical doctors of today. And so it is not because they are giving trainee nurses and midwives allowances, and so many of them, it's attracting many of them, that is why commitment has gone down. Commitment in the police service, in the military, in the teachers, among doctors, wherever. It's not the same today. It's not the same as in the yesteryears, and so I don't get it.
But he's raised some very valid points as well. He's mentioned the fact that when we decide to do this, the proliferation of nurses training schools will be checked, and then again it will promote equity. If teachers' allowances are being scrapped, which is also an essential service, then we can as well scrap that of the nurses to ensure equity.
That is also another area where John got it wrong, because you see, if it is you are striking in the discussion and running, if you want to strike the chord of equity, you don't take it from the angle that he did it. First of all, is it right that allowances of teacher trainees should be scrapped? I don't think that is good enough. And so if you want to strike equity, the argument is not to say that that of nurses and midwife trainees must also be taken off. You
right. Kweku, please, just hold. Kweku, hold on a minute for me. Hold on a moment. Dr. John Koku Williams himself is also joining us in the conversation. Thank you very much, Dr. Williams.
Thank you and good afternoon, Michael.
Good afternoon to you too. But why is it essential? Why is it critical at this point that we scrap the allowance?
I think that this is a debate that we should open up for discussion. First of all, I work as a regional director, and I also work as a clinician, so I have both sides of the coin. First of all, I personally think that it is getting to a time when we have to let students take responsibility of their training. If you take the profession, the health sector, there are so many categories of profession. We have medical scientists, we have lab assistants, we have pharmacists, we have doctors, we have nurses. And if you take all this, they contribute to the whole total care delivery in Ghana. So increasingly, if you tease out only nurses and we continue to give them allowances right from day one to the time that they complete their education, whether it takes them 2 years or 3 years or 4 years or 5 years, they continue to be on allowances. It does not bring any equity. And the debate that is going on now with the teachers, I think it's also appropriate that we add all other categories of staff, students, who are taking these allowances. I am saying that if the time that these allowances were very, very relevant had gone, those were the days that we had just about 10, 12 training schools in Ghana, and therefore the intake was low. We wanted to attract many people to the profession, and so we have this incentive to attract them. But currently, my sister, we have over 80 nursing training schools in Ghana, 80. And the intakes are huge. We are turning out more than 5,000 nurses every year. And the allowances are a huge amount of money. If you take the health sector budget, we have 92% of the total budget going for salaries and allowances, leaving only about 8% for actual service delivery. If this is not the time for us to start reviewing our policies in terms of training, in terms of allowances, in terms of expenditure on the health budget, then I don't know what better time it will be.
Right.
So I am making this point because I think it's time for us to open a debate to discuss it. It is not to disenfranchise nurses, but I think that when people look for alternatives to fund their own education, they become very responsible, they become very committed to the course that they've taken in terms of training and profession, and they become more dedicated.
Right. In your submission, you mentioned that there is absolutely no accountability for the management of trainee nurses, nurses' allowances. Why do you say this?
I said this because we have a system when nurses, students, let me say students, nurses, when they enter school, they are put on allowance right from the day one. Now, a nurse can have her program for 2 years, meaning that she's supposed to receive a training allowance for 2 years, for which she will finish her training and move on to be employed. Now, this nurse can fail her final exam and disappear for 2 years. And for the 2 years, she will continue to be on allowance and appear after 2 years to write her exam and then pass and move on. And we have so many examples of this. So the idea is that even for the fact that people are running 3-year courses, they can take allowance for 5, 6 years. This is not accountability.
I see. Dr. Awuno Williams, please hold the line for me. Kwekwa Sante Krabia, who is the president for the Ghana Registered Nurses Association, is on the other line. Kweku, he's made valid points, hasn't he?
I don't think so. Because you see, the last statement you put in that they continue to take allowances even when they fail their final exams is not true. The system has been sanitized in such a way that after your 2-3 years of nursing and midwifery training, if you complete, you go off the allowance. And then it is upon writing and passing the professional exam, that's the licensure exam, that you come back on the allowance. And at this time, it is not student allowance, it is national service allowance. You do that, you go on that for 1 year, and then when you complete your internship, which we are calling this time national service, you go off the allowance until a facility employs you as a full-time working nurse or a midwife. And then you start your career as an employee nurse or a midwife.
Right.
We have witnessed situations where the managers of the system have overlooked the essence of ensuring that the nurses go off the allowances, and so we have on record a few of such mistakes. And he, from where he's sitting as a regional director, I'm sure he has seen one or two such incidents. But that is not to say that it's a generalized situation where we have students failing their exams and still continue to. That is the thing of the past, and I'm the system that manages that process. So
I see.
I'm giving this information as a fact.
So as it stands now, how long do nursing trainees receive this allowance?
Well, their training program is 4 years. A fourth year, that is the internship, is a must because you have to complete that one to get to earn your certificate. But the first 3 is the attachment to the training institutions, where when they finish, during the period, they have the student allowances. If you fail, the system now has it that if you fail, you go out of the allowance. And
let me ask you something quickly. Why can't our nurses also just access the students' loan just as students in the public universities are doing?
Well, we are talking about a situation that has existed in the past. Where we were giving allowances to nurses and midwife trainees for a reason, and a good reason, of course, because you see, if you start to make comparison like teachers are not getting it, these people are not getting it, you are equating the trends and the structure of their training. But I must say they are not the same. That is not to say that nurses and midwives are more important or more special. That's not what I'm
will
saying.
it be such a bad idea for the nurses, the trainees, to just be on a student's loan facility than have allowances from government?
Well, we're talking about an incentive. When you go to take the loan, like all of us in our university training, it happened to us when we took student loan allowances. We are not saying that it's the same as giving it to the person for free as an incentive booster. But that is an arrangement I believe must stay because these nurses and midwives we are talking about, at the point in time when they take their clinical training program, they work just like any other qualified midwife or a nurse. And during the time that some other trainees in other institutions go on long break and they have the whole time to themselves, these trainee nurses and midwives are on the clinical field working and getting supervised by the qualified nurses and midwives and some other health personnel, even including doctors. So I believe that it is because of this that we feel when it comes, we maintain it. It will remain a booster for them.
Let's talk to Doc quickly. Doc, in your submission as well, you made mention of the fact that this practice of giving a leeway to nurses to just go in and out of school as and when they want to after failing their licensure examination is prompting some of them to just go into private practice without necessarily having the license to do this. How prevalent is this problem?
I think that, first of all, let me just say that I agree with Koku when he said this practice has been there in the past.
Right.
But like I think I agree with him. And once the practice has been in the past, it's time now for us to look at it. I mean, have a debate on what goes on now. I mentioned the fact that we had those days 20 schools, 20 schools. Now we are talking about almost 80. And you multiply the allowance that you just mentioned that they take every month to the number of schools and students that they have. And that is the effect on the budget.
Right.
Now, the practice that you mentioned, I think is very rampant. I mean, because a nurse who completes. And let me also make a point on the fact that when they finish, they go off automatically. I think that is where the problem is, that we are seeing many of the principals, either the principals or those who are responsible for that to happen, not happening. And so we are seeing many of those things that people finish school and they're still on allowance and they haven't passed their exams. It takes 2-3 years.
Right.
Now, coming back to the point that you mentioned, it's rampant because somebody completes and fails his or her exam.
Right.
Then he or she moves to a private facility. I'm waiting for my exam. The private facility will employ the person as a nurse who is waiting for her results, even though he or she has failed.
Right.
Then continue to work there for 1 year while he's working, collecting salary, he's still on allowance. I mean, that's the problem we are having.
Right.
And so I think that what I'm trying to do is not to say that nurses are not important. I think that they are playing a critical role, just by the fact that as many of them that enter the school also leave within a year or two to other professions.
Doc, we'll end it here and perhaps speak on this debate later. But Kweku, has this come to the notice of the Registered Nurses Association that some of the nurses who are practicing in private hospitals and clinics have not even passed their licensure examinations?
Well, it has not officially been registered at our association level, but I believe that if even somebody like Dr. Awuno has a private clinic, he will want to take on such professionals. And
is that right?
That is not right, I must say. And that's why I want the private practitioners also to examine the competence of such nurses, even with regard to ensuring that they even have the certificate to practice as nurses and midwives in their establishment before they take on. So if that is happening, it is not a mistake of the nurses, it's a mistake of the private practitioner who fails to ensure that...
Kweku, we'll end it here and continue later.
Right,
Kweku Asante Krobia is president of the Ghana Registered Nurses Association. We also spoke earlier to Dr. John Koku Awuno Williams, who is director of the Ghana Health Service Upper East Branch. Right, let's move on to some other stories relating to the Supreme Court verdict. And President of the Legal Advocacy Foundation, Dr. Maurice Ampao, has been explaining to Joy News the rationale behind decisions by the justices concerning issue of no signature of presiding officers on pink sheets in the just-ended election petition.
With the issue of the majority decision when it comes to signature, they hold the view that, look, the signature of the presiding officers, although constitutionally mandatory, there's a sharp provision, but they believe that, look, when you are interpreting the Constitution, don't look at the letter, don't look at the strict interpretation. Go beyond the letter and look at the spirit and then the purpose for which that provision was made. And to them, the purpose for which that provision was made is to ensure that at every police station, you can verify and authenticate the results by either signing of signature by the presiding officer and then police agents of the party. In looking at the Constitution, you don't look at ordinary and literal meaning. Look at the spirit. Don't look at the letter, look at the spirit and look at the purpose. And to them, the purpose for signing is to authenticate and then validate the results. So if party agent did sign, and after signing they authenticate, and then after signing the results went to collection center, no complaint was made, it was authenticated, signed, and then they went to the strong room, then it will be unfair and unjust and fraudulent on the part of the petitioners to come and raise technicality that, look, presiding officers did not sign, therefore the vote should be annulled. So the minority position is that we cannot give any excuse for not signing. The presiding officers are not only officers alone, they are officers of the EC, and their signature validates. So the constitution is quite clear. There's no issue of interpretation. So they don't agree with the majority position that we ought to apply a purposive approach. That's the purpose, and then the spirit is clear. He said, you, the presiding officers, you shall. So straightforward, there's no problem of interpretation. So the minority is saying that, look, don't let us use interpretation theories and principles to overlook a clear constitutional duty. There is referred to constitutional duty. Whilst the majority are looking at administrative duties of the presiding officers, the minority is saying that it's not administrative, it's constitutional duty. Therefore, the judges are called upon to protect and preserve the constitution. So to them, the majority have failed in that direction in protecting and defending the constitution, because they have allowed violations, and then they are using technicalities of the law to justify the violations.
Right. He also touched on rationale behind decision of the justices on overvoting.
Overvoting and vote revocation, the petitioners should not only rely on pin sheets. To the majority, especially the Zatugba, the pin sheet is nothing, because it does not have any constitutional definition. There's no constitutional definition. There's no statutory definition. So the pin sheet is just a mere paper that we presiding officers have to account to whatever happened at the police station. And then to them, as Riley said, he saw a lot of errors, administrative errors on the pin sheets, grammatic errors, numerical errors. So by the pin sheet alone, it is not enough to rely on it to determine what overvoting and voting by revocation means. So to the majority, led by Atukuba, the petitioners failed to produce other evidence to support their case, and they said that they struggled. They should have called for the register and called for the coalition sheet, but they failed to do so. So those evidence could have supported their claim, but only relying on pin sheets alone to determine overvoting and voting by revocation, they did not give in. But the minority said no. There was evidence on the face of the pin sheets. The pin sheets is the primary record, and that is what record that the Afrajan used to declare the results. So let's go by what is on the pin sheets, and that's the evidence. So we realize that the majority have their way. So I can say that whilst the majority are talking about let's look at what is fair, what is just, they were also a little bit technical. Whilst the minority were also being technical, but they were also being frank with the evidence. So you have these 4-5. Surprisingly, that's what normally happens. It will surprise you that these same judges in other cases may change their position. Right? Let me tell you that this decision that has come is not binding on the Supreme Court judges. Next time when there's an election dispute, they might change their position based on what they are seeing and how they see the law. So I want the other person to take his time and know that the decision of the majority now prevails, and their decision is that the president was validly elected, and then the minority was that, look, the president was not validly elected because there ought to be some rerun.
Let's go to the Upper West region, and the Security Council for the region has placed an indefinite ban on the movement and sale as well as slaughtering of all four-legged animals in the Wa municipality due to an outbreak of anthrax in the area. The Upper West Regional Veterinary Officer, Dr. Paul Pulkun, said the ban is to protect people from contracting the disease and prevent its further spreading.
Following the normal procedures with anthrax, of course, we immediately put a ban on the movement and slaughter of livestock in the whole, of the municipality. It's in Ward Municipal, and yes, within the 8-kilometer radius, as normally what we practice. There is no movement, no slaughter of all the species of livestock, the four-legged, sheep, goats, cattle, and pigs. So a ban has been placed on movement and slaughter of these species of animals.
Regional correspondent Rafiq Salam Mumuni is joining us on the telephone for an update on the situation. Hello, Rafiq.
Hello, come in.
Rafiq, what's the latest with the anthrax situation in the Upper West region?
The latest news is that the veterinary services here have started mass vaccination exercise on all four-legged animals in the municipality. According to the regional director of the veterinary service, Dr. Paul, he told me that they will be vaccinating about 30,000 four-legged animals in the municipality before they will now give the green light for the butchers and other people to go on with the sale and transporting of the animals.
Well, what we know is the region is supposed to receive some 30,000 vaccines, but got only 10,000. Is that to say that they have the whole figure now, the 30,000?
According to the regional director, they only have 10,000, but he has sent for an additional 20,000. And so he's hoping that by tomorrow, they should get the other drugs to complement what they're supposed to do. And so he's hoping that by tomorrow, they should have the drugs so that they will be able to do that vaccination. But they're also calling on officers from the other district because the disease is in the one municipality, so that they will join hands and so that they can do it quickly and then give the butchers and other people the opportunity to get back to work.
It's not the first time we are hearing of the spread of anthrax in the three northern regions. Do we know how this occurred in the Upper West?
The first time we heard about this disease was in the Upper East region, and then but in the case of Wa, it happened around the 25th of August. That was last month, when an unnamed pig farmer came to the veterinary service and reported about the mysterious death of his pigs. And then he said that he lost about 4 or 5. And then the veterinary service went there quickly in the night, and then they did the testing. They took samples of, and then they brought it to the lab there, and it was detected that they were dying from anthrax disease. And so those pigs were buried immediately, and then after that, the ban was placed. And so it started at Paguri. In the Paguri is a suburb in the one municipality,
right, Rafiq,
and then through pigs.
And that is my fear now. This could have been a crossover from the Upper East region to the Upper West. So tell me, what measures is the veterinary outfit putting in place to ensure that this does not go outside the boundaries of the Upper West region, and this ban on the slaughtering and movement of four-legged animals is enforced?
Actually, the measures that they have put in place, like you rightly said, is about the transportation of these animals from the one municipality to any of the neighbors, to any of the districts in the region or outside the region. That is one measure. The second aspect has to do with the the mass vaccination exercise, which they have just embarked on. And then thirdly, they are advising all farmers or all individuals who are rearing these four-legged animals, at least if they suspect any string disease from their animals, at least they should quickly report it to the authorities.
So, Rafi, are people consuming meat in the region?
They aren't. So this total ban on the sale of meat, four-legged animals in the Upper West region, in the one municipality. And so in Wa, you can't sell meat here. If you sell meat, you will be arrested. And so there's a total ban on the sale of meat in the Upper West region, whether it be the cow, be it a goat, sheep, or whatever. And so there's a demand for guinea fowl, and then also poultry products on the rise, and fish are on the rise in the one municipality. So there's no way that people are taking meat.
Thank you very much, Rafiq. Rafiq Salam Mumuni joined us from the Upper West region. And on that note, we take a break. When we return, we'll do some more. Hello again, this is the Midday Brief. Moving on with our stories. The University Teachers Association stated categorically it's still on strike, though the Legon chapter of the association returned to the lecture theatres yesterday morning. and president of the University Teachers Association is joining us by telephone to tell us if they have had the assurance they were waiting for in order to return to the lecture theatres. Dr. Anthony Simmons, good afternoon to you.
Good afternoon.
Dr. Simmons, have you received the assurance you've been waiting for?
Not yet.
Right, and so as it stands, UTAG is still on strike?
Yes.
But tell me something. Yesterday you mentioned of the fact that NEC would meet concerning, Legon's move to return to the lecture theatres. What's new with that?
Come again?
What is new with NEC's decision over Legon's return to the lecture theatre?
We sent in a letter to them just now to, advise them or to remind them that, they've gone contrary to one of the articles in our constitution, and then by that they should reverse their decision pending next meeting.
But what have you heard concerning this, assurance you've been waiting for from government?
Well, we know there's going to be a meeting between the Vice Chancellor of Ghana and then the presidency. So we're waiting for the outcome of that.
When is this?
Today.
Today. And what is the hope after that meeting?
Well, we were expecting that the mandate that they need for payment will be given them.
Right. Thank you very much, Dr. Anthony Simmons. Dr. Anthony Simmons is president of the University Teachers Association, and yesterday he assured us that immediately that assurance for the payment of their book and research allowance is given, they would return to the classroom irrespective of the time. Let's quickly move on to some other stories on the midday brief. And the Africa Agriculture Status Report says Africa has the world's lowest capacity with only 70 researchers per million inhabitants. Wednesday launched its inaugural report on the states of African agriculture in Maputo, Mozambique. The Africa Agriculture Status Report takes an in-depth look at the staple crop value chain from classroom to field to market in 16 countries across the continent. The report was made available to Ghana News Agency by Francisca Rutja Moreda, International Affairs Researcher at Portland Communications. The report brings together data and analysis from more than 15 national and international organizations, including Ministries of Agriculture, the World Bank, the Food and Agriculture Organization, and the International Fund for Agricultural Development. It presents data in an accessible and consistent format, creating a benchmark to monitor the development of agriculture in Africa. The inaugural Africa Agricultural Status Report focuses on staple crops such as cereals and root crops, around 75% produced in Africa. The report reveals that while a number of countries are investing heavily in research and developing the agricultural sector, others are lagging behind to the detriment of food security. It's noted that declined soil fertility threatens crop yields and agricultural development in a number of countries, while the average price of fertilizer delivered to farms in the United States is $226 per ton $226 per ton rather. It is $414 per ton in Zambia. Let's do some international news now. And Syria rifts loom over the world leaders from the G20 group of nations are set to meet in Russia amid sharp differences over military action against Syria's government. Ahead of the talks, Russia's President Vladimir Putin warned that action without UN approval would be an aggression.
Petersburg is supposed to concentrate. President Barack Obama says the credibility of the international community was on the line. While Syria is not officially on the G20 agenda, leaders are expected to discuss it on the sidelines. The annual summit of the G20 group of developed and developing nations, which opens in St. Petersburg, is supposed to concentrate on the global economy. On the eve of the summit, a U.S. Senate panel approved the use of military force in Syria, a response to an alleged chemical weapons attack. The proposal, which now goes to a full Senate vote next week, allows the use of force in Syria for 60 days, with the possibility to extend it for 30 days.
In other stories, a car bomb has targeted the convoy of Egypt's Interior Minister Mohammed Ibrahim, but failed to harm the politician. The security forces report at least 4 people were injured in the blast, which reports call as an assassination attempt.
Reports say the minister's convoy was targeted as it traveled through Nasser City. Nasser City is the stronghold of the Islamist Muslim Brotherhood group, but there is no word on who was involved. The explosion took place at around 10:30 local time near Ibrahim's home. Quoting security forces, state-run MENA news agency said a booby-trapped car exploded in Mustafa Al-Nahas street as the minister was en route from his home to the ministry. The interior minister in charge of the country's police force, which alongside security forces carried out a deadly security crackdown in the capital last month, clearing 2 protest camps set up by the Muslim Brotherhood supporters of ousted President Mohamed Morsi. Nasser City was the site of the larger of the 2 protest camps based outside Rabah al-Adawiya Mosque, which was dismantled in the security operation on August 14.
Sports is next with Baba Kadi.
By the kind courtesy of Tigo, we are back to talk sports, and it's all about the action happening at the Baba Yara Sports Stadium tomorrow in that big World Cup qualifier between the Black Stars of Ghana and the Chipolopolo of Zambia. Very soon we'll go onto the phone lines to speak to my colleague Benedict Owusu-Dankwa, who is stationed at the Kotoka International Airport awaiting the arrival of the Zambian team. But before then, let's go to Kumasi and speak to my colleague again, Redwan Ibrahim Asante, and he is going to tell us what's happening in Kumasi as fans wait for the Ghana Black Stars to take on their Zambian opponents, the Chipolopolo, who are even yet to arrive. So we'll get to talk to Redwan in a little bit. But before then, let's check out other stories. Let's go to Kumasi right now and see what happened when the Black Stars arrived there in the Garden City yesterday. They were welcomed by a lot of fans. They were met on arrival by a lot of football fans in Kumasi, and they wouldn't let them be. So let's see what happened in Kumasi yesterday.
I will not deny this because I was there and accepted this. He even behind this. Oh. No, he is one of those. I see now you are now you are changing your mind. Let them go behind the car and give them This is very funny.
Definitely will address them from you. You will address them from you.
You know, psychologically, Zambia is claiming to have an effect on us. That's what they claim. But I know they can't, and they wouldn't be able to defeat us. And I'm convinced I have my solid team here that will do me the honor and Ghana the honor by defeating Zambia on Friday. Whilst watching you play and training, I realized the confidence that all the players had. And the yellows were trying to beat the greens, and the greens were trying to beat the yellows. That shows the preparation that you've made. Psychologically, I believe strongly that you are all committed for what is ahead of us. The whole of Ghana is looking up to you. And Friday, all what I want to hear, my sons, are that Ghana has beaten Zambia by 4-0. And I know we can do.
All right, so that happened yesterday on arrival when the Black Stars got to Kumasi. They were met by a lot of fans. Otumfuo himself, the #1 supporter of the Black Stars, he was also there. And of course, a whole entourage from the sports ministry and from the Ghana Football Association. Now let's go directly to Kumasi on the phone lines and speak to my colleague on standby, Ridwan Ibrahim Asante, to bring us up to speed on what's happening. Hello, Ridwan. Good afternoon.
Good afternoon, Rush.
Ridwan, what's happening in Kumasi? I've seen a lot of visuals. Kumasi is bubbling. Is the situation the same?
I tell you, people are really looking forward to this match. It's one big game on the calendar, and everybody, wants to play a role in this, crunch game we have at hand on Friday. People are really eagerly awaiting for kickoff. They can't wait to get their tickets ready. Just that there's been some problems with ticketing. But I think as the eyes, spring, things will be okay, and everybody will be able to get tickets to buy.
So are you saying as we speak, the tickets haven't gone on sale yet?
No, it went on sale, I think, for less than an hour. It started at, instead of 8 o'clock a.m., it started at 9:30, and even it wasn't done orderly, so it was a case of the survival of the fittest. If you're strong, you were able to, bury your way and then get a ticket or two to buy.
Wow.
And that's been the status quo since yesterday. So it's been very, very problematic for the skinny and slender guys who've been queuing since 4 a.m. People came 4 a.m. And it's also been good business for ticket scouts or ticket scalper or for ticket scalpers here at the Baba Yara Sports Stadium. What they've done is they come in early, buy the tickets. Let's say the cheapest goes for 4 Ghana cedis, and then sell it, as high as 8 Ghana cedis or 7 Ghana cedis. I had the opportunity of speaking to one ticket scout who told me about him selling, 4 Ghana cedis for 7 Ghana cedis each. So he's made a profit of 6 Ghana cedis, and he just can't wait to use that as lunch.
Wow, that is very interesting. But Ridwan, have the players had any training sessions yet?
No, there'll be a final one today at 5 p.m. And that will be preceded by a press conference at 4:30 p.m.
Wow, and I'm sure the stadium would be entirely filled when the Stars take to the Baba Yara Stadium to train.
Unfortunately, this training session is closed for public viewing. It's closed to public viewing, and so people will not be here.
I see. And Ridwan, have you been speaking to any of the players or the officials or indeed members of the GFA, finding out what's been happening with the Zambian team? They are still not here as we speak.
Yes, there's been official communication from the FA. The Zambian team is expected to arrive anytime soon. And then what will happen is that they are expected at the Kumasi airport at 2:45 p.m. That's what we understand. That's been the official communication. But I don't know if the team, or the delegation have touched down already in Accra.
I see. Ridwan, we'll reach you again sometime soon for details and as to whatever is happening in Kumasi. So do keep well, and thanks very much for your time.
Okay, thank you very much, Raj.
That was my colleague Ridwan Ibrahim Asante from Joy Sports, bringing us up to speed as to what's happening in Kumasi ahead of that crunch game tomorrow, which the Black Stars must win. Indeed, they need just a draw or a win to go through to the final qualifier for the 2014 World Cup in Brazil. And it's against the Chipolopolo of Zambia, who till now are not yet in Ghana, who haven't touched down at the Kotoka International Airport yet. But let's see what happens in the coming hours. Probably they will touch down and go straight to Kumasi, and then probably let's see what happens. If indeed they will be able to train before that game tomorrow, that's something also that's left to be desired. But that will do it for sports for this afternoon. My name is Rashida Baba Kadiri. Remember that the match will be live on Joy 99.7 FM. Sports will take over the airwaves at 3 p.m. tomorrow, and there's live commentary from the Ghana-Zambia game. You should also follow us on myjoyonline.com because we'll be streaming live. Tigo is our power sponsors. Thank you very much.
And before we do some showbiz news, the Institute of Economic Affairs, in collaboration with the European Partnership for Democracy Integrated Support Program for Inclusive Reform and Democratic Dialogue, held a national conference to foster women empowerment in governance. The conference was under the theme Fighting and the Representation of Women in Political Decision-Making in Ghana. The Minister for Gender, Children and Social Protection, Nana Oye-Litha, was worried despite Africa's progress, gender balance in governance was still low.
The Institute of Economic Affairs, IEA, in collaboration with the European Partnership for Democracy, Integrated Support Program for Inclusive Reform and Democratic Dialogue, INSPIRED, held a national conference at the IEA premises to foster women empowerment in governance. The theme for the conference is Fighting and the Representation of Women in Political Decision-Making in Ghana. The Minister of Gender, Children and Social Protection, Nana Oye-Litha, presented a keynote address.
I spoke to the issue of affirmative action in Ghana. I referred to the historical imbalances, the fact that women have been underrepresented for a long time. And so the process of having a law that will correct this imbalance, that will ensure that we have more women in public office and decision making and in governance, a legal framework to facilitate this process is what we're talking about. And the ministry has finalized our proposals, and we're in the process of drafting a bill for that. We are going to look at the educational sector, how we can increase numbers and ensure that girls are retained.
Nana Oye-Litha added, despite Ghana being heralded as a thriving African democracy, the nation shows little progress in achieving gender balance in government, with the participation and representation of women in national decision-making still remaining low after 20 years of democratic rule.
This forum and this platform which IEA created was to discuss what should go into the bill, what should not go into the bill, what sort of enforcement we should have.
She said gender inequality and development of women empowerment has not been consistent over the past 50 years. Even though some African countries have made significant progress, Ghana still lags behind. A segment of the conference created the platform for invited dignitaries from the NDC, MPP, and CPP, as well as corporate bodies, to deliver their solidarity messages.
I am a son of a woman who single-handedly took over the family when my father went to political asylum in 1966. I also remember that I am the great-grandson of a woman who was so fiery in the court of Yagbongura that she was given her own chieftainship at least 16 kilometers away. So we have always had very strong women in the family. And as a scientist, I think most of our people are not aware that in gene succession, the female gene contributes more gene content to the progeny than the male gene. And in plants, we call it maternal dominance.
Now some showbiz news. And after campaigning against hepatitis B, Ochama Kwame is working tirelessly on a whole new musical project which aims at bringing Africa together.
Known for his versatility, one of Ghana's finest musicians, Ochame Kwame, after 16 years in the music industry, is coming up with a whole new phase of music. Titled African Connection, the 16-track album is going to feature 16 renowned African musicians.
It's time for me to move away from my comfort zone and taste the world music and see how it feels like, and the precious and the nice cities around it. So the new album is called African Connection. And then, yes, it features 16 great musicians from 16 great African countries.
According to the rap doctor, the African Connection album is geared towards connecting Africans together. Ochame Kwame says the African Connection has already started, and he is yet to complete the song Another Day with his Nigerian counterpart Jay Martins, who left Ghana yesterday after recording his part of the song. The sensational Nigerian artist Jay Martin tells us he is excited about his collaboration with Ochame and entreats all Africans to look forward to another day.
He's a great philosopher. He writes poetry. It's like, and sometimes it's like someone who speaks in parables. You need to understand it.
African Connection will also feature the likes of Navio from Uganda and other exciting artists. So keep watching the space for Ochame Kwame's African Connection album.
Well, that's it for showbiz, and that's it for the hour as well. Before we go, a quick recap of our headlines. An Upper East Regional Director of Health Services asks Ministry of Health to scrap allowances given to trainee nurses, just as has been done by the Ministry of Education. Ghana Black Stars ready for World Cup qualifier against the Chipolopolo of Zambia. In foreign news, bomb explodes near convoy of the Egypt's interior minister in Cairo, wounding at least 7 people. There's more news on myjoyonline.com. Many thanks for watching. My name is Kimini Nyamani Amano.